I said yesterday that we are facing our biggest challenge to date and that we can and we must rise to the challenge, and that is exactly and precisely what South Australia has done. We had more than 5,000 people who were tested yesterday. I'm now advised that today we are on track for more than 6,000. This is nothing short of sensational and will be a record for South Australia. So my heartfelt thanks to every single South Australian who's heeded the calls to go out and get themselves tested, and we're very, very grateful for that. I'll soon pass over to Professor Nicola Spurrier for the daily update. But before that, I need to reiterate to the people of South Australia that we are not out of the woods yet. We are just at the beginning stages of dealing with this particular very nasty cluster in Parafield. We are going to get through this, but we're going to get through it with the cooperation of every single South Australian citizen. Everybody must play their role in making sure that we stop this disease in its tracks. It is very, very important to do that. We have beaten clusters before, the Barossa cluster, the Adelaide Airport cluster, the Theberton College cluster, and we will beat the cluster at Parafield, but we must do it together, working together, listening to the restrictions and, again, getting ourselves tested as and when we need to. I'm now going to pass over to Professor Nicola Spurrier.
Thank you and good afternoon. Well, unfortunately, we have some more cases to report today. And for today, we have 5 new cases. 4 of these are linked to the Parafield cluster. One of the cases, I've only just received the result and they're now being interviewed. So I'll have further details about that case once we have them to hand, and that will be most likely reported through tomorrow. In terms of the other new cases, we've got one case that is associated with the aged care facility, the Anglicare aged care facility, and it's one of the workers there, and that person is now in quarantine in a medi-hotel. The other 3 cases are family members of one of the security guards who is associated with the medi-hotel. And because of that, in fact, we've had to give information to the Roma Mitchell School to close down until further notice. So the ages of the new cases range from somebody in their teens through to someone in their 50s. And importantly for South Australians, all of these people have either no symptoms or they are very mildly symptomatic, and they've been picked up early in the course of the disease. So the other thing I'd like to tell people about, and some further results that we have about the Parafield cluster, is that we now have the genomics information back. So that's the testing of the genetic material of this virus, of this strain. And we've been able to link, we did the testing because it was the first case, you'll recall, was the older woman in her 80s. We've tested her strain and we've linked it to somebody in the medi-hotel where her daughter worked. And the person who was the traveller arrived in South Australia on the 2nd of November and was tested on the 3rd of November. So prior to this, prior to the 2nd of November, we did not have COVID in the state, but that's when it was introduced, this particular strain. So in addition or just as a summary up until midday today, in terms of the numbers, we've got a total of 20 cases now linked to this cluster. But in addition to that, we have another 14 people who we are suspecting may be cases, and we are still doing testing to confirm that. But these are people that we feel are at high risk of becoming a case and have symptoms, and we're just waiting for that testing to come through. But because we want to be very, very precautionary and really work very quickly, that is the reason why we are calling them suspect cases, and we've put public health into action to make sure that we can contain it. So those people are either awaiting a test result or we have an initial test result that's negative, but we're highly suspect and we're retesting them. And the reason we're doing this, obviously, is because of this very high risk of onward transmission in our community. So around, I was asked yesterday, how many of these close contacts are in quarantine? We've now got around 4,000 people who are close contacts who are quarantined. And these people have been advised to quarantine, and they're being contacted on a daily basis for a symptom check. So this is a huge amount of work, as you can imagine, to make sure that we are in regular contact with these people. So in terms of school closures, we now have 5 schools. And there's the Roma Mitchell College that I mentioned, and that's in addition to Mawson Lakes Primary School Preschool Complex, Thomas More College and the Holy Family Catholic School that I mentioned yesterday. And there's also Mount Carmel College. That may be able to be released, but we again being very precautionary in this instance. So some closures may be longer than others, and it really depends once we start to get the interviews through and get more information, and then we'll make a determination. But we've decided to take a very, very cautious approach and just get on and have people go into quarantine. So parents, you need to look at the website, at the Education Department website, and also, of course, your own school's website to get an update of what this will mean for you. The other thing is we have some updated advice. So updated advice for all South Australians who visited the Aquadome in Elizabeth. So this is much more specific advice. Anyone at the Aquadome between 11 a.m. and 1:30 p.m. on Saturday, so last Saturday, the 14th of November, we now want you to quarantine for 14 days and get tested immediately. So we think that the exposure was more significant, and we want those people to get into quarantine immediately and get tested. Now, obviously, we'll be chasing up with the Aquadome to see if we can get direct contact details, but this is an early warning to those people. Anybody that was there with their family and children on Saturday between those times, get yourselves into quarantine until further notice and get tested. So in summary, in terms of active cases, there are now 34 active cases in South Australia. This brings our total to 549, with 511 recovered. As the Premier indicated, South Australians have heeded the need to get tested, but get tested with symptoms, please. I know that I've stressed that many of the actual cases have had very mild, if no symptoms, but we do need to prioritise our testing across South Australia. And I know that many of you would have been a little frustrated with the wait at our testing stations today, and I do thank you for your patience. But we're particularly wanting South Australians who are symptomatic. There are other people who we've actually directed to have testing, and in many instances we've set up specific pop-ups and particular testing arrangements for them. So there were more than, there's been now more than 595,000 tests for COVID since February. I really want to stress this is early days in this cluster. And whilst we had that large number over the weekend, we have, a significant number of new cases today. Importantly, they have all linked back to this, the genomics and also with the interviewing to this medi-hotel, but there is one case today that I cannot give you any further information about because they are still being interviewed. Please heed the fact that we need to be more restricted now in South Australia. We have put some legal directions in place to have certain high-risk activities closed down, but every single one of us need to start thinking about, do we need to go out, do we need to do that activity, and make some sensible choices about that. People who have chronic health conditions, who are in an older age category, I urge you to stay home as much as you possibly can at the moment and get your family or other support people to do your grocery shopping and such like for you. Now, I know it's very disappointing to have to do that, but we really do want to stop the number of contacts that people are having between each other. And so, as the Premier said, we do have these new restrictions in place and these have to be adhered to. Thank you to all the South Australians that have listened to this advice. I agree with the Premier. If we all work together, we will get on top of it, but it is certainly early days. The other thing I would just like to say is because we've had now cases in the Peppers Hotel, which is the medi-hotel to which this is linked. There are a significant number of people who have travelled from overseas and have done their quarantine there and are nearing the end of their quarantine time and expecting to be released and to travel back interstate to get on with their lives here in Australia. But unfortunately, we are still working through whether it is safe for them to do so, because obviously they are now in a hotel where we've had some active cases with the staff. I absolutely sympathise and understand your frustration, but in terms of our public safety, not just for South Australia, but the whole of Australia, I urge you to be patient and please, we will try and inform you absolutely as the time passes as to your situation. And we have a significant number of GPs and other health staff who are working individually with these people. I just also wanted to let people know that we are working very, very rapidly and a real focus on getting more SA pathology staff. And I know Clinpath and ACL are also trying to do as much testing as possible. I know that the waiting time for the COVID screening clinics can be quite long, but we are trying to get additional staff in place and working to have them open for longer periods of time. And at the moment, they're running from 8 in the morning till 8 at night.